It's a bright light. You're set? All right. Good afternoon, everyone. We want to bring to you some numbers today. Our numbers, our new cases have been the highest each day that they've ever been for the last 4 days. Now, keep in mind that we've got more testing going on out there. And so when you test more people, you may see your numbers go up. We've also had 18 people so far this week die. That brings our number up to about 280 people who have died. The more concerning number, though, that we want to focus on today, and Dr. Wong's going to talk to you more about, is the number of hospitalizations. Hospitalizations were hovering around 250, 300 for COVID for quite a while, and over the last 3 days, they've jumped up to about 370. That is a significant, statistically significant jump that the doctors are watching closely. On the weekends, some hospitals don't report, so the weekend numbers are not all that valid, but they'll be watching very closely those Monday and Tuesday numbers to see what happens with that. Actually, what we've seen is the last 3 days here in Dallas County, it's the highest we've seen. And the last 3 days here in North Texas, in our 19 county area, it is the highest that we've seen. And so we're seeing a resurgence throughout Texas, most acutely in Harris County, but you're seeing it begin here in Dallas County as well. So it's imperative that we all make good choices. If we go back to that document that the doctors put out originally in May, that color-coded chart, which can be found at dallascountycovid.org. If you don't have it, download it from there. If you do have it, you may want to go back because they've updated it. There's a lot more information on there. We're going to talk about some of that information. But it gets down to 4 simple things. Avoid crowds, 6-foot distancing, wear that cloth face covering when out in a crowd, and finally, use good hygiene. I want to announce 2 new testing sites today. As you know, we opened 2 walk-up sites at Redbird Mall and at Inspired Vision Compassion Center in Pleasant Grove. That's since the last time that we had one of these press briefings. But today we're also opening through a partnership with Walmart a testing center at 915 North Town East Boulevard in Mesquite. That's going to be Tuesday through Thursday starting June 16th. And then a drive-through site at 2650 State Highway 161 in Grand Prairie. And that one will be Monday, Wednesday, and Friday, 7 to 9. And so you go to that. You can get more information, again, on that at dallascountycovid.org. We talked about testing for our protesters. In a partnership with the Mavericks, we had 2 days of testing at AAC for protesters. You don't need to be symptomatic if you've been in a mass gathering, whether your mass gathering was a protest of policing or whether your mass gathering was the Trump rally last night. If you go to a mass gathering, 5 days later, you can go to one of our test sites, tell them that you've been at a mass gathering, and get a test. It's very important that you know your status, okay, and that the doctors can help you with that status. A normal COVID positive person will have 10 contacts to be traced. If you're COVID positive at a mass gathering where there are 300 people, there might be hundreds of people to be traced. And so it's very important to protect the community and your fellow people at your mass gathering, that the doctors, not the police, but the doctors know who the positives are and can help keep them and their families safe. And that is a private information. Some of you have heard of HIPAA, which stands for the Health Insurance Portability and Accountability Act. It does not allow, not that we would want to, but it does not allow the doctors to, release that you got a test. Look, if you don't want to say you were at a protest, Just say you were at a mass gathering. We won't know whether you were at the Trump rally or a protest. We just want to help get you tested so you'll know your status. The testing doesn't count against the public charge rule for people with a concern about their immigration status. It's private and it's confidential. Now, unless there is an extension, our moratorium on the filing of evictions runs on Monday, and therefore I want to talk to you about rental and mortgage assistance. For families who are still facing trouble paying for housing due to COVID-19, the county's renter and mortgage assistance program is live and taking applications. Applications can be made directly with our partners, Catholic Charities of Dallas, Catholic Charities of Dallas, and Jewish Family Services. Families who are facing eviction will be given priority for assistance. So if you need help, go to Catholic Charities of Dallas and Jewish Family Services. I don't know if there's any staff that knows this, but is that also on DallasCountyCovid.org? It is. And so you can go to, it's a one-stop shop. You can go to DallasCountyCovid.org to find whatever you're looking for. So know that if you need mortgage or rental assistance, particularly with evictions starting up potentially very soon, use that. Another thing that is new at DallasCountyCovid.org is the doctor's guidance for high-risk individuals. So they put a guidance document. It's also red, orange, yellow, green color chart, and it's for high-risk individuals. So a high-risk individual is anyone over 65 years of age, those in nursing homes or long-term care facilities, anyone with an underlying medical condition like severe asthma, diabetes, or obesity, among other conditions. And it has a sheet for them, and it's pretty easy to read, simplified, shorter than the other one sheet. And then it has a sheet for those who are around them. So for those living with a high-risk individual, household members should conduct themselves as if they are a significant risk to the high-risk individual. Okay, we're currently at red for the color-coded chart for the Public Health Committee, made up of public health experts, infectious disease experts, and epidemiology experts. And so when you apply that to the high-risk individuals and their caretakers, it means this. High-risk individuals should only travel for essential needs and should telework when possible. They should not visit friends or families without urgent need. They should avoid all physical interactions with people outside their house. They should wear face coverings and frequently wash their hands and clean their environment. For those who interact with high-risk individuals, they should wear a face covering, avoid physical interactions, frequently wash their hands, and clean your environment. Do not visit hospitals, nursing homes, or other types of facilities where you could have a higher risk of exposure to the virus. And again, full guidance on high-risk individuals is at DallasCountyCovid.org. Also new today is guidance for apartment complexes. We've heard from a number of residents over the last few weeks with questions about how they can stay safe in their apartment complex, and so we've released guidance that can help these facilities. This information is also available on that same website, DallasCountyCovid.org, but I want to point out a few key things for multifamily dwellings to keep in mind. Routinely clean all frequently touched surfaces in common areas like mailroom, laundry room, game room, elevators, door handles, delivery areas, and make hand sanitizer available everywhere. Place signs limiting the number of people in common areas like laundry rooms, mail rooms, and elevators so that 6-foot distancing can be maintained. Require employees wear a mask or cloth covering if interacting with residents, and have visitors such as mailmen and delivery personnel will wear masks while inside the apartment complex. On contact tracing, we currently, as we have more and more positive tests, that's more and more contacts that need to be traced. Remember, the way this works is someone has a positive test, and then they're contacted by a contact tracer who wants to find everyone that they've had a close contact with. Close contact is more than 15 minutes, within 6 feet, within 48 hours before the onset of symptoms through the sickness. Again, for most people, that might be your nuclear family and a couple of coworkers. But for others, it might literally be dozens and dozens or hundreds of people. And so we've got to add more contact tracers. The Commissioner's Court authorized an additional $10 million for contact tracers, and Dr. Wong and his team are working very hard with Parkland Hospital and others to hire an additional 260 staff for this effort. Later this month, too much to announce today to get to it, later this month we'll be announcing and showing a demonstration of the new automated contact tracing system in collaboration with Parkland Hospital and the Parkland Center for Clinical Innovation. In a moment I'll turn it over to Phil, but let me say this. No one is more tired of talking about, thinking about, and working on COVID than Dr. Wong and I are. And it is, I know it's an exhausting thing for families out there. A lot going on. We're about to see the political season start back up. President Trump's going to have his first mega rally in Tulsa, I think next week. And so you see that start back up. Other things will start back up. I know people want to take their mind off the drudgery of this long deployment for us and long ordeal for you on COVID. But I want you just to remember this thing. This disease doesn't care that we're tired. It doesn't care that we're distracted. It doesn't care that we have other priorities, okay? It is relentless in finding a host and getting as many people sick as possible. And unfortunately, it's a new disease and we don't have an immunity to it. And so I'm not telling you not to be focused on other important things. What I am pleading with you is that you maintain focus on your health, that you continue to do those things that will keep you and your family safe. If we do that, we've got a good chance of getting through this and getting our economy moving again. If we fail to do that, we will see a wave of new cases, and that will be crippling for both public health and consumer confidence. Remember this, folks. Right now, here's what you're all saying. This sucks and I want it to get better, right? But if we keep having waves because we lack the discipline to follow the doctor's advice as a community, we're not going to be saying this sucks and I can't wait for it to get better. We're going to be saying this sucks and I don't know if it's going to get better. And that's when businesses go under. That's when people lose their jobs, all right? So to coin a phrase from, Jerry Maguire, help us help you. Stay with that color-coded chart. Mamas, pull that thing down, and when your kids ask you to do something, look at what the doctors say. I don't question anybody's common sense, especially not any mama's common sense. But these doctors have trained their entire adult life to advise us in this moment. They've looked at exactly what is legal under the governor's orders, exactly what is happening on the ground here in Dallas, and then they've said, here's what we would recommend. And I would just strongly encourage you to follow their advice. And with that, I'll turn it over to Dr. Wong. Bill.
Well, as the judge mentioned, today we are announcing now 328 new positive cases reported, and our total case count is now 13,585, and 3 deaths announced today, so our total number of deaths is 280. The 328 is the highest number we've reported in a single day, and then each day for the last several days has been sort of the highest record numbers. I think, we typically, we've been reporting all the nursing homes and things, but now we're over 30 something. So I think we'll defer that to other sources, but we do have those numbers. But want to just get to some of the monitoring data that the judge referred to. As was noted in the prior one, we are still in the red zone in terms of the risk level and stay home, stay safe. But we've been looking at the emergency department's visits for COVID-19. If you really look at the last week, you can clearly see it's going up. We've been flat. We've been somewhat pleased that things hadn't spiked up in some of these indicators, but you can certainly see in the last week some indications of going up, and I'll talk about that in a second. We are, in a timing-wise, probably about 2 weeks away from when Memorial Day weekend occurred, when several things opened up. And so the timing for impact of some of these numbers can certainly fit with that. Next slide is the available ICU beds. And so this is one that we don't want to be going down. We want there to be more available ICU beds. But what you can clearly see the trend since probably April 24th, that there's been a steady decline in the number of available ICU beds in Dallas County. So that's not, again, a good sign or the direction that we want that particular indicator to be going. Next slide is the general hospital admissions for suspected COVID. Those are the persons that new admissions within the prior 24 hours. You can see for the last week here, that increasing trend. Next slide is the COVID-19 suspected, the ICU admissions to the ICU. That one's been a little flat for the last week, but again, certainly no decline in that. Next slide is then the general hospitalizations for the last week. And so these are the number in the census number that are admitted and staying in the hospitals in Dallas County. This is probably where you see some more of the more dramatic increase in this for the last week. Clearly, this is in an uphill trend. These numbers, and as the judge mentioned, are some of the highest we've seen. Then the next one is for the lab-confirmed ICU hospitalizations. So again, for the last week, steady increase, almost as high as we've ever seen in some of those numbers. And together, when you add the general hospitalization numbers and the ICU numbers, then those are, again, at some of the record highs. And this last slide I think I have, this is actually the last one, next to last is the deaths. This is by deaths by actual date of death. So it's a little different from, when we announce them every day, it's as soon as we get that report. Sometimes it takes some, processes to confirm the deaths, but these are by the actual dates of death. Those have been relatively flat, but keep in mind the latter, there's a delay in some of that reporting, so some of the latter week to 10 days are delayed, and we keep filling them in as we get some of the new reports. But the final slide just wanted to show, and this is for the entire it's called the Trauma Service Area E. It's some of the multiple counties in our Dallas-Fort Worth area. But this is that combined number of general hospitalizations and ICU hospitalizations. Actually, that's an error. It should be ICU hospitalizations in the last 7 days. And just for those last 7 days, you can definitely see that trend upward. And those numbers, and I think yesterday's number was as the highest we have ever seen for that single number in terms of hospitalizations and ICU hospitalizations in our trauma service area since this whole event started. So, we're monitoring this. These are not the directions that we want to go. As the judge mentioned, it is so important for everyone to keep doing the physical distancing, staying 6 feet apart, wearing the cloth facial coverings, washing your hands and not touching your eyes, nose, and mouth, and really, the color-coded risk guidance, where we're the local experts are saying what we recommend because we think we are still in the red zone. Those are the recommendations that people should be practicing, and that's what it's going to take for us to keep some of these numbers down. But certainly, some of these latest numbers are concerning. So I think that's all I've got.
Anybody have any questions?
I got two questions. Do we have a percentage of total tests that are being done compared to the ones that come out positive? And then the second question has to do with the report today and yesterday. I think it says that more than half of the positive COVID-19 cases are Hispanic people. What is being done with that information?
Repeat the question,
Okay.
because he's not mic'd.
Okay.
You, go ahead, you answer it. Say it.
Sure. First question was about the percent positives of cases. And so we do have some of those numbers on our the Tuesday and Friday, more detailed epidemiologic reports that are on our website. Now, the numbers that we have are for just the hospitalized data, because that's where we have good numbers on the denominator, how many actual cases. I'd have to look at the exact number for that. I can get that to you afterwards. But it is on our Tuesday and Friday report. So we'll have a new number that should be coming out, I think, probably shortly if it hasn't come out. I don't know that I saw it today yet, but it should be coming out very shortly with the latest on that. Then, we don't have for the whole entire community because there's not a good we don't have all of the numbers for all the tests that are being done by all the private sector providers and those. But so that's why the best numbers that we have for that are with the hospitals. But understand, and one of the reasons we really have not been using that as a key indicator is that the hospitals even have been changing some of their testing policies. So as some of the elective surgeries and other surgeries have been going back to being performed, they've been doing testing everyone before surgery, every pre-op, and so that changes the percentage of positive because they're getting a lot of other low-risk people that it's not a uniform testing. So you see variations in that. Also, many of the hospitals are testing every pregnant woman that comes in for delivery. So again, that's why some of those indicators aren't as good of an indicator to follow. That's why they're not in our key indicators that we put in there because, again, they're not as the key indicators that we're depending on are more independent of what testing is being done. And so that's just some of the things that you have to look at. Like statewide, there were some of there were numbers out there in terms of percentage positives for the whole state. But that, again, there were some initiatives where every nursing home was being tested. There were a whole initiative to test rural areas of Texas, some of the rural areas that didn't have any cases even. So you're really diluting some of those numbers in terms of what's the, being able to track consistently what's the percent of positive means. And so that's, again, an example of why that indicator is not as good. The second question was about the large number of Hispanic patients and positive cases that we've had, those in the hospital, and definitely that has been of great concern to us. We've been looking at that in terms of, it's partially what the thought is. It is persons that are this type of work that they might be doing where there's more pressure for them to have to go to work and they don't have the opportunity to stay home if they're sick and so some of the frontline service occupations, some of those things. And so we're really trying to get that word out. We do a lot of all of our materials are translated, Spanish translation. We are doing a lot of interviews with Spanish media and in bilingual coverage and reporting on that. We are doing a lot of our community outreach on the ground in the community efforts, working with the education with the people in the community, educating the store owners on proper preventive type of things and other things in the communities that are reflected with that also, based on our maps, some of our hotspot maps, some of our zip code maps. And again, that is absolutely and something that we are trying to address. I don't know if the judge wants to add anything else to that, but again, it's an area that we are working on.
Okay, thanks.
If I may, Judge, have you appealed to the governor at all, had any communication in the last several days about slowing down his open Texas order? Here we've got another phase opening up today for restaurants. Have you talked with him? And also, is there an update on officers getting tested?
Yeah, so two questions. I'm going to say those over. Have we appealed to, or have I appealed to the governor with his relentless reopening in the face of these increasing numbers that we're seeing? What I have done is I've asked the Public Health Committee, which is made up of the chiefs of epidemiology at the major hospitals and the chiefs of infectious disease, the CEO of Parkland, Dr. Wong, the president of the Dallas County Medical Society, and other experts to meet, and they're meeting tonight in 34 minutes, and come up with recommendations for what we would be seeing when we would, what the governor should be looking at for him to slow this down. I think it's hard. The politicians have made it really clear, President Trump's made it really clear that it's full steam ahead on opening the economy regardless of what they see. And so it's really hard to say to them, well, based on what we saw yesterday, you need to recalibrate and put public health ahead of this. We're hopeful that if we can put a mark on the future and see if it happens, we'll all be working to follow those good sound judgments that you can find at Dallas County COVID so we don't get to that point. But if we get to that certain level in the future, we can have already agreed, Governor, this is where we're asking for that. I've reached out to other counties and asked them to join in that effort. We'll have more announced on that at a later time. The second question that Jobin had was, what about officers getting tested? Officers can always be tested. You can be tested at any of our sites without symptoms, and we want our officers tested. They're doing brave work out there. They're putting their lives on the line, so we want for them to have that. And I would point out to the officers, as I do on my noonday call with them every day, with their chiefs anyway, it's very important. If you've been in a mass gathering, you may have not been around a protester, but if you're around another 100 officers for an hour, 2-3 hours, all standing next to each other, go ahead and get your test too. 5 days after you've done that, first time you've done that, go ahead and get tested. Go back on one thing that the question about why are so many Hispanics getting sick with COVID. So for every 100,000 people, it's 664 Hispanics compared to 43 Anglo non-Hispanics. So 15 times as many Hispanics. Why is that? Well, partly you could say that's because Hispanics in Dallas County are nearly twice the population of Anglos in Dallas County, but if that were all it would be, their number would be at 80-something, not 664, right? I mean, I didn't do well at math, but I can do that one. The reason the number is so much higher is because when it was time to open our economy back up, the people that risked their lives to get you your groceries, to work in those manufacturing plants, that are working in those meat processing plants that are getting sick, they tend to be Hispanic. They tend to be people without access to primary care doctor and health care. Something for all of us to remember as we move beyond COVID and we look at lessons learned for COVID. Public health means everyone has access to affordable health coverage. So any other questions before? Yeah.
Dr. Wong, with the testing that we had, the walk-up testing the past couple days for protesters, and the fact that there's going to be continuing testing available for people who took part in protests, how do you plan to use that data? Will you be able to kind of look specifically at how many protesters are testing positive, and then get some sense of, maybe further guidance for people as they continue protesting. I know the city put out some recommendations, but, be able to kind of say, hey, you are taking part in protests, here's what you can do to stay safe while doing so.
Sure. So the question was about with the testing now for the protesters, what will we do with that information? How will would be looking at some of the details on. I think we are going to definitely. We wanted to make sure that the availability of that for the persons who've been protesting is available because again we're. The situation just with the large crowds and people being close together certainly makes more opportunity for spread of the infection and we've identified it as higher risk and that's so that making the testing available to everyone but I would say we're not collecting information to ask if they were specifically protesting or not, and that's part of we're not trying to single out because again we fully support people having the opportunity to express their opinion. We're very again supportive of that, but we don't want to identify people their activity necessarily with that. But I think in general we will if there's impact from this timing wise probably in a couple weeks. We're hoping that we don't see increases in the numbers in general or in the population demographics. I mean, that's what, when we report some of these and in our Tuesday, Friday reports, we put, some of the demographic information on who's positive. And so, I think we report that always. It may reflect some demographic, indicators that are, maybe aligned with the persons that are participating in those. But, we don't know, and we're not going to report it and single them out. But again, we're hoping that people that are participating will practice all the prevention efforts that we can to really try to physically distance of 6 feet apart and make sure and wear the facial coverings and have hand sanitizer available. And I know that the Mavericks and the judge have worked on getting hand sanitizer out there and masks and things. I mean, that's what we know will help prevent that. We'll continue to monitor the data that we do. And again, we do it for more of the population and see what those numbers might look at. We're not singling out specific groups.
Do you know how soon we might expect to see, given the incubation period, if there is a rise? How soon are you going to be looking? I mean, are we kind of in that window now and it's going for a couple of weeks?
Yeah, probably, 10 days, couple weeks, into the third week. That's where we would maybe see some of these indicators.
One thing to remind people of, to get a test for being in a large group gathering without symptoms, it is any congregation of people. So if no one is even going to know that you were at a protest, if you were at a church camp with 30 people, if you were at a religious service, if you were at the Trump rally last night, if you were at a protest. And the reason that's so important, think about, as those of you who are watching, think about how many people you're in close contact with each day. It's probably about 10 people. But if a person is going to a group setting of 150 people and they're sick and they're shedding the virus, but they don't know it, or they're an asymptomatic shedder, that's going to make dozens and dozens, maybe hundreds of people sick. And so because of that extreme risk of harm to the people around you, if you're going to be in these large settings, we want to get you tested. It's confidential, and it needs to happen, so please, get tested and let's all protect those who are in close contact with you. With that, thank you so much, for covering this today. I think Rebecca will do it for you in Spanish.